Right, yeah, here it is. Okay, so what you're looking at here is that you have under the protocol, which is the same protocols used in the ILO. What is the protocol? Is there a current safety risks such as a high number of COVID-19 cases in the geographical area of your operations? Yes or no? Now, we have been doing, then the Ministry of Health has sent out a map with community mapping. So you're going to look at that map and decide, because you can't do this in isolation. You may not have this information. So you're going to look at that map and decide, yes, I am in an area where there have been a large amount of coronavirus, COVID-19 cases. So therefore, my vulnerability has gone up. But if you say no, or even if you say yes, what controls do you presently have in place to deal with that? What do you have right now? Do you have controls at your entryways? Do you have controls within your facility? Do you have controls in exiting your facility? Do you have controls or recommendations for your employees coming to work and going back home? Okay, remember, this virus does not exist in our work environment alone. It exists everywhere. So these controls we have to have controls for every environment in which your worker could probably find themselves. Now, the government sets out guidelines for us to follow, but we then have to take those guidelines and tailor-make them to our organization. So in the existing controls or safeguard, you will put down, yes, I have so-and-so, this is what I have, and you will make a note. To what extent? Then you would use the normal risk assessment evaluation, 1 being low, 5 being high. So, right, what is the severity of it in your area? You can say, well, the severity is a 4. Yes, we have it, it's high, but not that high, or 3, or 2, or 1, depending on where you are. You put that figure in there. The next figure under the probability, what is the probability of it existing within your organization or to a member of staff? Same thing, 1 to 5. You multiply those two factors and that will give you a risk rating. Now, I know many of you are familiar with risk assessments and how they work, so I won't go too much into this, but basically that's it. But the next step you want to look at is, what else can I do to control this?
Hi, Robert.
Yes?
Sorry, are we supposed to be seeing the document?
I thought you were, because I was seeing it.
No, so just you just need to stop sharing the presentation and share the document.
Yeah. All right, do what now?
Just click on share screen at the bottom of your screen.
Share screen, right. Oh, okay. Sorry about it.
Select the document, yes.
Okay, is it there now?
Yes, thank you.
Okay, I'm so sorry. I was rambling on. Okay, so going back to the document, as you can see it in front of you, protocol, yes or no, following the ILO standard, existing controls and safeguard, your risk rating, and additional controls. So what I was saying before is that you may have some existing controls, but those controls may not be enough, or you need to develop on those controls. So put that in there. Give it a risk rating. Basically the severity or the probability, multiply those two figures between 1 and 5, 5 being the highest, and it'll give you a risk rating. At the bottom of this, of the whole program, there is a chart that goes into this. And then you go into what additional controls or safeguards should I put in. If you do get one case, if one person calls in and says, guess what, I'm staying home because I have symptoms of COVID-19 and so forth and so on, how does that impact on your organization? The person may not have it, but they have symptoms of it, so they have decided to self-isolate. What controls do you have in place to ensure that this does not as a continuous system? I have a philosophy on being sick, and a lot of, or some employers may not agree with it. When you're sick, stay home with your sickness. Because when you pass this on to all my other employees, I may not get everybody at the same time as with this coronavirus being out, but I have a continuous sick call of employees being out for 4 or 5 days, 3 days, whatever, because they are homesick, because this cold, this fever, this whatever is being passed around from person to person in the office. So I think this coronavirus, what it's done for us is made us look at our sick leave policies and how it is implemented in a much serious way, and how we have to look at how do we deal with it, because it does have an impact. We're finally seeing what the impact this has on our organization. So going back to this, what existing controls or safeguards you want to put in, how will they work? And then again, you go back to doing another risk assessment in terms of severity and probability, and it should come down. If it goes up, something's wrong somewhere along the way, so you have to go back into it. But it should bring it down. It does not say it's eliminated, but what it says is that we have done all that we can reasonably do, practically do, to control this in our environment. Now, I'm not going to go through each and every question. We're going to be here for a whole hour doing that. But basically, you go for each question. If it doesn't apply to you, then just put NA in the box. But look at it. It may be something that you want to look at later on. So that goes into one of your leisures as something that you need to look at later on down the line in order for you to ensure that you are protected from this risk. I hope I've explained this enough for you. We can go into it at another time or take your questions on it. The ECA will be sending you all 4 of these forms. Like I said, feel free to use it within your organization, copy it, change the questions. You can use it for other things. All right, it is for your benefit. And I hope it helps you in recognizing the risk and the vulnerabilities within your organization and how they impact on you and what you need to do about it. It's one thing to recognize a risk. It's another thing to ignore it. Once you recognize a risk, you need to take what is reasonably practical to either eliminate or control that risk. Okay. Right, let's get back onto the program. Right. So everybody's seeing this, right? Right, the ILO?
Yes, we are.
Right, okay. The ILO has developed the risk programs. I went through that with you, all right? And the self-assessment. There are 3 phases to any business continuity plan. The first phase is prevention. This is when you are making up your plan. This is when you are looking to address what are the probable risks that exist in your organization and what you need to go to mitigate the impact and preparing for a response for this, such as the simplest one that all of us probably know, preparing for a hurricane or for a flood. You recognize the fact that your building is in a low-lying area. You recognize the fact that your entrances is very accessible to water. So at certain times of the year, when we do have our rainy seasons, you get flooded out. What can you do to mitigate this? Right? What are the options available to you? How practical are these options that are available to you? And the affordability as well. Let's not leave finance out of this, because finance plays a big role in what we decide or what the direction we decide to take our mitigation programs, right? So preventative measures such as real critical stocks. If your stocks are, if you have critical stocks that are being stored in a warehouse off-site, and at point in time, you may not have access to it, whether it be a flood, a landslide, whatever, geographical disaster. Do you think that that is a practical way to keep some of your critical stocks? And maybe we need to turn things along a little bit. So that's one of the things that you need to look at. In the preparedness stage, implement your plan. Many people have plans. Many people have written plans. But have you tested your plan? If you don't test a plan, you don't know if it's working. A lot of times businessmen say, well, we don't have time. I can't shut down my plan to test the plan. But if you don't do that, when the day comes when your plant does have to shut down, when you do have to do this, when this disaster hits, you don't know what the outcome will be of your plan because you have never tested it. You've never tested it to see where the shortfalls are and where corrective measures have to be made so that you know it will work. I am a big proponent. Let's do a tabletop exercise. Sit your people who are members of your plan, those who are involved with it, around a table and run a tabletop exercise. How can they make decisions right there at the table? Think fast. What is next? And you get to see where your people have shortfalls in either their understanding of how the business runs or what they need to do at that time in terms of their responsibility within the plan. You must write this information into your job descriptions. I cannot stress this enough. Because if you hire somebody new and you put them in what we call a critical position in your organization, and they are not prepared to deal with any type of adversity that comes up there, either they don't have the previous experience of dealing with it, or they have not been trained in it, you're putting yourself at risk. It needs to be in the job description. He or she needs to be trained. They need to test the plan. They need to understand what are their responsibilities. And this goes from chief cook down to bottle washer. Everybody has a responsibility in your business continuity plan for their area of operations, and they need to understand what are their responsibilities there. Otherwise, you're not properly prepared for when the plan takes place. So make an inventory of alternative suppliers, establish a first contact system. How do you get this plan working? Now, your business continuity plan is so that you can continue in business. But if you have suppliers or partners within your business that you depend on, such as people who service your equipment, your IT people, and so forth and so on, they need to be in your plan too. You need to understand their needs. I am a safety and health risk management consultant, but I don't have one client. I have several clients in several different industries. And at one point in time, all of my clients and past clients are going to call me up and say, Robert, what's going on with this? We need to talk. I need some direction. I need this. So everybody is going to be impacted. So if you don't bring all your partners into your plan and involve them in your plan, in your testing of your plan, you're creating shortfalls in your plan that you will not be able to address at that time. You need to address these things before they happen. So test your plan, write down what went wrong, do corrective action, see what needs to be done. Response. What is your response to it? Once you have done the testing, what are the lessons learned? Have you really sat down, or maybe you haven't as yet because of the situation, but you need to sit down with your management staff and say, okay, how did this impact us, each and every one in each and every department? What do we need to do? We realize that, guess what? I'm going to go back to college days now. You have one man who operates one late, and he's the only late operator you have who knows to run that late. And he came down, or he had symptoms of the coronavirus, so therefore he was home for more than 14 days. So that part of your operation came to a halt. And then finally, the rest of your operation followed suit. Okay? So do you have that type of bottleneck or that type of stopgap system in your operations that if this area stops, nothing else is going to happen after that? And how do we deal with that? What measures can I put in place? So lessons learned is very important in moving forward, all right? Alternative suppliers in case of disruptions. Everybody I'm sure remember 3 years ago when the Ministry of Health said that you are not to, they stop importing, and you are not to use any beef products that were made in Brazil because they were tainted. You know what the impact of that was on grocery stores, and more so on hotels and hotel suppliers, because many of them bought their meat products from Brazil. It's closer, it was cheaper, right? But when you have every hotelier in the Caribbean looking at alternative ways of bringing in meat, New Zealand, Australia, wherever, the United States, and they're running up and down trying to look at alternative ways to bring meat in order to keep that hotel business going, or the grocery stores filled. Several things that happen. You're having a glut on the system. Those other suppliers were not really ready for that, because they were sticking to what they had to do in terms of their production. And all of a sudden now, the demand outweighed the supply. And you were stuck in the middle as one of those people saying, where am I going to get this product from? I need this. Because your main supplier went down. And you have to think of in that type of limelight in everything, whether that supplier is local or international.
Hi, Robert. Sorry to interrupt again. Maybe you can go to the slideshow where part of the text on the slide is blocked out. We're not seeing some of what is on the slide.
How do I, well, oh, okay, so is that better? Is that it? Okay, is that it?
Yes, I think that should be fine.
Okay, great. I don't need to see me talking. Right, so example of response in terms of contact alternative suppliers in case of supply or chain disruption. But you don't wait till the impact of the disaster. You should be looking at alternative suppliers from now. Even if you're doing not a large volume of business with them, but some business, so that at any point in time, if you do lose your main supplier, you have somebody you can call on. Because if you call that supplier now and say, by the way, my name is so-and-so and I'm looking for someone, you say, yeah, everybody is, but I have my regular customers that I have to deal with. Let's face facts. All right, so we have to do this in advance. This is basically how it works. A BCM is the business continuity management. How do you manage your plan? So the first thing is equal to preventative measures prior to the occasion of the disaster, plus your preparedness arrangements, plus your response when disaster occurs. This will equal how you manage a business continuity plan. What are the most important services? Consider the following kind. What are your most important product and services? What takes the larger core of your business? Not just in volume, but also in finance, right? What is your largest revenue source? Determine the product or service essential that should be maintained, even at a reduced scale. Now, in some cases, and this in economics, this has happened here, where businesses have been surviving not on what is their largest supplier or their largest customer, but the other customers who remained in business because of the nature of their business, and they were able to give them more business and increase their business. So you have to look at it from both standpoints. Identify what you need, raw materials, human, financial resources that are available through external or through internal or external sources. Are you able to finance this internally with your money? Or do you have to go to your bankers? Do you have to change your financial arrangement with your clients so that instead of giving them 30 days credit, you have to now move it to 15 days? Because you have to have a quicker turnaround of your raw materials to meet the needs or the requirements. All of these are situations that you have to consider in your business continuity plan. Right? Identify key external dependencies through your risk assessment. People, process, profits, and partnerships. So through the risk assessment, you will identify what are your internal and external dependencies in there. And then what else can affect your business? What external hazards? When this pandemic started last year, it was mainly China. One province, lockdown. And then what happened? China started to lock itself down. And then people realized how many products and services that we use that come from China, either in a finished product or in a part of in terms of a part, a service, a keyboard, something that went into building a bigger product. And we rarely realize it. Even personal protective equipment. The largest manufacturer at the time was China. So when people were calling for it, they were realizing that China was using up its own product, and in some cases, they weren't making anymore because the factories were closed. So other institutions or other countries who could have changed their focus of their operations to fill this stopgap. And we have seen it happen here in Trinidad and Tobago with industries now making hand sanitizers and making dust masks. It's become almost a home business in some cases. So look at the external dependencies, what you're dependent, and identify what else can affect your business. External hazards happening to business and services. We pride ourselves in Trinidad and Tobago that we really do not get hit with hurricanes. We haven't, I don't think we have had a hurricane here in more than 20-something years. But when you look at places like Dominica, St. Lucia, Jamaica, going up the islands, and so forth, hurricanes are prevalent. As a customer base or as a supply base, how does that impact on your business? The East Coast of the United States have seen more hurricanes in the last 5 years than it's seen in the previous decade, and very strong hurricanes. Even right now, there was a tropical storm about 2 days ago off the Carolinas. So we are looking at having a pandemic and a hurricane at the same time, and nobody knows what the outcome of that will be, whether to wipe out the pandemic or spread it. What are the government regulations in each island or each country that you're dealing with? What are our regulations here? How do they impact on us, especially when they bring in these interim regulations to deal specifically with this pandemic? What is the impact on us? Restrictions on accessing port or movements of goods and services. The government closed the borders, but they did not close it to food and essential food items coming in because they recognize that. But we have to look at that too in terms of, is it going to, is there a possibility of this increasing the pandemic in our country? So what are the restrictions we need to put in place in our businesses to keep that out of there, such as sanitizing the products when they come into your warehouse or when they go into the store, and so forth and so on. Not just from the clients coming in and touching it, but coming in from outside. I don't know if anybody remembered, about 5 years ago, Australia lost 6 people who died from Ebola, but it wasn't something that came into Australia. It came from another country that was selling Australia's, I think it was raspberries, and they weren't being washed properly because they're very delicate fruit. So they didn't do any heavy washing of it. And people were using it directly out of the stores. And therefore the Ebola virus was still in it. And it caused the deaths of 6 people. So somewhere in that process, somewhere in that production, growing, shipping, receiving process and sales, the Ebola virus went through all of those processes and caused the death of 6 people. I'm just trying to bring my point home. I hope I've done that. Utilities, water, electricity, public transport. Right now, the government have put certain things in place that you can only, in public transport, you're only carrying, I think it was 50% capacity in order to keep social distancing. How longer will it take your workers to come to work? Getting up earlier is not going to make that much of a difference because the transport system can only take so much and the time in getting there. Are we having problems with our water and electrical supply? We are going into that time of the year now where the WASA has said that we are very low in our dams because of the rainfall. So then just now there may be a shedding or sharing of water. So therefore, using water on a constant basis that we've been using it, every time you go into a store, if it's right next door, you wash your hands. Okay? And let me tell you, I have seen how people open that tap. It's in a gusher. So 3/4 of the water is not being used to wash your hands, but it's just going back down the drain. So our water use has gone up. We are home more. Children are home. People are home. We're not at work. But guess what? Our electrical use has gone up as well. Because why? The television is on more often. Air conditioning systems are running because it's hot. More things are going on, computers, so forth and so on at home. So while you're doing more stuff at home and less at your business, you are using the utilities at a higher rate, and the organizations who manage these utilities have to ensure that they continue to service you. Consider the following measures when you're trying to identify your key products. As I said before, the share of income they generate, whether it be yearly, quarterly, monthly, or even seasonal. There are some businesses who make the bulk of their income on a seasonal basis. They deal with Christmas. They deal with Carnival. They deal with holidays in terms of making their money. The amount of clients demanding them. Income may not equate to quantity or demand. Okay? The cost of non-delivery. Your inability to meet your client's needs. What is that? What will that impact on? Not just your client going somewhere else to do the business, but what is the impact on you and your business? Negative financial impact, productivity, reputational consequence. Reputation we have to look at. West Indians are very, how should I put it? They're very conscious buyers. We tend to stay with products that we have grown up with, and we recognize these labels. And a lot of very savvy marketing people have taken that situation and used it in their marketing. So right now, when you say Clorox, everybody think bleach, but that's a label. But it's stuck and it's there. So again, what is a reputational consequence if you're unable to come out on the market or to meet your market needs? Your product and service are essential services in your supply chain. Look at your supply chain. Where does your supplies come from? Your raw materials. And who do they get their supplies from? So in some ways, you have to go all the way back to source and recognize that if there's an impact at the source, there will be an impact at the person bringing it in and an impact on you getting it. Medical supplies, power generation, security, maintenance, these are essential services and are needed. Daily requirements for the general public, groceries, pharmaceuticals, transport, right? On the other end of the essential services are suppliers of gas, food production, media, print, or electronic. Because right now, 99% of us depend on the electronic media and the print media to get our information. So all of these are essential services within the supply chain that we have to look at and see where does it impact on our organization. Is your product or service essential services? The next step is to identify time critical operations, those operations that can be done for a shorter period of time with respect to others. So you're not looking at closing your services, but what operations are so critical and it must be done within a certain period of time. Maybe the product requires a certain amount of furnishing. Maybe it requires a certain amount of time before it can go on to the next step or the next production step. You have to look at that. Can it be done in a shorter way or a shorter period of time? Does it require less employees to do it? So look at these time critical operations. Some operations may have to be done at a certain time of the day, early morning for whatever, so that the rest of the operations can continue. You may do certain critical operations during morning or night. So therefore in the morning, what you do at night will be worked on in the morning. So you have to look at these situations. Beyond the time, which is called tolerated downtime period. How long can this be? Can this area of your business go down for? What is that tolerated downtime? And you need to know that. If you have if part of your operations are as refrigeration, one of the things that I ask my clients to do is how long under certain standards, whether it be HACCP or whatever food standard you may use, is that product in that refrigerator saleable or usable before you get rid of it, before you have to throw it out? What is the period of time that that refrigerator without electricity will be able to maintain your product? What is that tolerated downtime without electricity? And how do you control the temperature in there by not having people going in and out of there every 5 minutes? And looking at the cost of it. You may not have a backup generator, but should you have one, because this is a key component, this is a critical activity in your organization. So therefore, maybe backup generation is one of the ways you need to look at. So what are the alternatives? And is it cost affordable? Can you afford it? The impact of reputation on your business at stake, especially the comparison of your business with the same supply chain. The processes needed to be done on a regular basis. Suppliers, customer, major contract changes. You may have to make changes in your contract with your suppliers after doing this due diligence and looking at your supply chain and saying, okay, I need to increase here or reduce here. I need to change this contract in terms of this person needs to have certain things in place. There are certain organizations, when you go to work for them as a contractor, they do site visits. They want to make sure that your operations is not a fly-by-night operation and it's going to be there tomorrow. They want to see how your operations is run. Do you have certain management protocols in place, such as health and safety? Okay. And how is your operations run? Because they're not doing that just to get in your business. They're doing that to ensure that you as a supplier can do what you say you can do on a continuous basis. And that's the reason for these visits. That's the reason for coming in and asking all these questions and filling out the questionnaires and the tendering process and so forth. So that the people that we ask or we choose to do our business with are there for the long haul. All right, accessing your financial service. At one point, these financial services will be set up. Budgeting activities allow you to determine the cost of different activities and how best to fund it. This is not a no-cost situation. This is not just a policy you write and it's not costing us any money because it's just the paper and time and so forth. No, it is impacting on your business. It is impacting on your financial cost of your business. So depending on what you put into your business continuity plan and what you have in your operational manual will tell you exactly where these cost centers will be and how much it's going to cost you to do it. And you need to cost it out. One of the ways of determining where you may have problems is going back to school again. It works. Fishbone diagram, equipment, process, people, materials, environment management. Let's see, where do we have impact? What problems do we have there? Secondary causes, primary causes. Using these sorts of tools will help you to be more effective in deciding where you have the critical areas of your operations and how bad and what you need to do in those areas. All right, establish your objective for your BDC. What is the objective of your plan? What do you want to achieve? Resilience. You want to be resilient. You want to be there in the future. The capacity of an organization to quickly adapt to disruptions while maintaining continuous business operations, safeguarding people, assets, and overall quality brand. We talk about risk management, and one of the sayings in risk management is that the job of the risk manager is to ensure that no one or series of events will cause you to close your doors. So we're preparing for it. We're making you resilient, that you will continue to operate. Maybe not at the same level for a period of time until you can build back up your operations, but your operations will continue. Right? Besides, the direct rises of driving from a plan to deal with disruptive in a BCP program can generate other advantages for the enterprise and integrated management process, right? Differences between what happens and what and execution. Many times when I go to a new client and I said, well, I need to walk through your plant, I need to understand how things run, I need to see how your business runs, and so forth. And many times what he has in his operational manual and what goes on the business floor or in the plant is different. Somewhere along the way, things changed and the operational manual didn't keep up with the operations. Or people within the operations changed the operations in order to execute it in what they figured to be a more practical manner. And this happens a lot. It can help you generate more efficient ways of looking at your work. So you need to sit down and do a whole operational sheet of your operations and look at it from every standpoint. You can't just sit down and brainstorm this from a desktop. You've got to walk your operations. As they say, management by walk around. You've got to go out there. You've got to go and see what's going on. You've got to ask the questions. Why are you doing this way? But the manual called for this. Well, we don't do this anymore because of this. So what has to change? The operations or the manual? And this will help you point out where you have gaps in your organization. And instead of finding out about these gaps when the event happens or the impact of a disaster happens. So you need to do this very early, right? If you're planning for a crisis such as COVID-19, one of the first things you need to do, establish a business continuity management team. You cannot do this by yourself. Excuse me, please. You have to have a team working with you, whether they include external people or all internal people. You have to have a team of people. In some cases, we may be specific to dealing with a pandemic management. It's important that everybody knows what's their responsibility in the plan. You have somebody who has been appointed, let's say, as a health manager. What are their responsibilities? To coordinate prevention practices, worker screening for symptoms, Communicate new practices that will become necessary based on government regulations. Ensure worker training and cross-training. Distribution of personal protective equipment. This person has a series of responsibilities which they will be carrying out in your organization. And just like every other responsibility, there's a reporting aspect to it so that you know that it's happening. How about a crisis communication and media release person? Who is responsible for dealing with the media if something happens? We know that right now, social media tend to dictate how people think. The worst thing you can ever have is somebody on social media saying that somebody working at ABC Enterprises, one of their people have coronavirus. The impact in a community such as ours is very staggering on your business. So communication crisis. And don't wait for something to happen to develop your media release. This person should be developing draft media releases all through the year so that they're able to quickly bring them to the forefront, make quick changes, and you're able to deal with it. So you have to, and not just communication from outside, but communication inside, which is even more important. Communication with your staff. I have worked for organizations where I've been there for months, and the people on the floor know me, oh, that's the safety man. But they have no idea why I'm there. They know about health and safety because they've heard about it. But the management has not really communicated with staff saying, listen, we are implementing a health and safety program. And this is the reason for the program. We not just regulations, but we see the need for this, for that, the other. And you are going to be a part of it. You will have certain responsibilities, trade, and so forth. Communication. So communication in a crisis situation before, during, and after the crisis is very important. A program for training and cross-training, especially in essential functions. We're reaching the point now where we will be cross-training people in order to carry out various functions in our organization, because we are realizing that if we lose X amount of segment of my employment, of my worker population, I have to only deal with this amount. And how can I cross-train them? But this also involves, and let's not forget, the employee organizations, the unions. Because if you have union contracts, if you have specific contracts that talks about what job and the specifics of this job you need to bring your union and say, listen, in our business continuity plan, we will be asking people to do certain things. It is not in their regular job description, but they may be called upon because of this in order that the business continues. So part of that negotiation is that a negotiation where the cross-training comes in, change of duties, people being able to do other duties within your organization. I'm not being too specific because we're dealing with a lot of different companies who have different needs. So to be specific is kind of difficult in this situation. Evaluating the potential impact of disruptions on your enterprise and workers. How long can the interruptions last before becoming unacceptable? We tend to look at the status quo. Oh, don't worry, we can do without that. We can handle that. We have this, we have that, or I will do this instead. No. How long can you last when this becomes unacceptable? How long is your financing available to you before you have to go out and look for more? How far can this take you in your operations? The disruption of business activities. When can you resume activities? As soon as possible, minimize losses, maintain good reputation with your firm. How soon? But this calls for going back again to communication with your clients and your suppliers. Folks, I hope I'm making myself clear. Business continuity planning is not your business alone. It's everybody who's associated with your business. And you have to bring them in on it. You have to have discussions with them. At some point in time, you have to be making some strategic decisions, right? Development and the management of your business continuity plan. Allocate and deploy resources as needed. Taking care of your workforce. What decisions are being made? I had a client who in their conglomerate owns a grocery store, a large grocery. And what they did was, in doing their disaster preparedness plan and their business continuity plan, one of the things I encourage them in doing is doing a database of their employees. Not just how long they've been working for them and what position they're in, but how many members of the family do they have? Where do they live? What other requirements they have? Okay, so that when we were looking at a possible hurricane, and that was no more than about 3 or 4 years ago when the government said, you know, pending hurricane, and we went into a hurricane watch. They were able to pack and box groceries for each one of their employees using their grocery store, and send and give this to the employee to go home with, so that what the employee had time to do was to put measures in place in their department to secure files, secure information, to close up database, whatever they had to do within the part of their disaster preparedness plan, in the part of their business continuity plan, to ensure that after the event has passed, things are in place. You're asking an employee to work at a point in time when everybody is looking after their family, and this person has a family. You want that person to be very focused on what they're doing. But they can't be focused on that if they're answering the cell phone every 5 minutes. When are you coming home? Can you pick this up? Can you do this? We need to do this. I want to bring my mother over by us. I want to do this. I want to do that. So when they have to deal with all of these and these are just as important to them, extraneous circumstances, while focusing on what you're asking them to do in the business continuity plan, you really need to make sure that you're taking care of your workforce, that you're offering them services, that you're trying to meet their personal needs so that they can continue to meet your requirements on the job. Minimum workers needed to run your company. Again, going back to demographics, right? How long will it take him to come to work in the morning? Where is he coming from? What is the likelihood of flooding in the area where he lives? Is he living in one, if you want to go onto pandemics, is he living in one of the areas that the Ministry of Health has identified of having a high incidence of COVID-19? So therefore, there may come a day that he'd call you up and say, I can't come to work because a member of my family has it, or I am self-quarantined for 14 days. So what is the vulnerability in terms of the community? Current ailments. One of the things that we look at very much is people in the Caribbean. We rarely do not take care of ourselves. We have a certain section of the population that is very, very healthy, physically healthy. But there are other stress and other constraints that go with that. The situation is that we should be redoing our demographic or our data sheet on our employees every year, right? Are you on any type of high blood pressure pills? Are you diabetic? What has gone on with you since the last time you filled this form out? I go to companies and we go through an auditing process. And when I look in the personnel file, the last time all of this information was updated was when the person took the job 10 years ago. I don't mean to digress. I just want to make my point. We had a situation where an employee got injured on the job, And I was asked to make the call to the employee's family. And I called his wife. Folks, I'm not saying this to be funny, but basically certain choice words were used to me on the phone and basically said, call the woman he's living with now. Don't call me. Because we have not asked the employee to update his information on that file. If the employee falls down on the job and faints, does anybody know that if he is diabetic, if he suffers from epilepsy, if he's on medication, what should we do? And in our country, you know, once something happens, there's a crisis, everybody becomes an expert. Everybody know what to do. So we need to be very clear on this. What are the health requirements of our employees? What type of training have we done with them? Many times we have sent employees on training programs and there's no record of it. We know they went, but when? Right? Who is responsible for training? What type of training was it? To what extent did the training take place? What did it go into? So we know what are the skill sets of that employee. What are their competencies in your business continuity plan? Looking at trauma in the person's file, absenteeism, right? Maybe increased work, difficulty to reach the workplace, increased family responsibilities. All of a sudden, instead of having the nucleus of a family, mother, father, children, you have father and children or mother and children because a member of the family has left the family. I don't want to say died, but gone. And therefore the responsibility of the family now falls on the one. That's stressful. And how does that impact on their ability to work within your organization or within your business when you are in a crisis mode? What can you do to continue to assist your employees in terms of getting a salary? There was a lot of conversation about this. The ECA had a wonderful program of this about 2 months ago. Ms. Fingal was the one who spoke about that. And several options were made that you had available to you in terms of dealing with your employees and continuous salary or remunerations during this COVID-19 period. And if they are participating actively as a member of your business continuity process and a member of your business continuity plan. So basically what their responsibilities are, what are their responsibilities for themselves personally? What is their health ability to take care of it? And vulnerability to them and to the organization. So you want to look at these type of demographics when you are looking at your employees. What about your suppliers? How can the suppliers meet your demand? What is their vulnerability to the crisis? Where are they located? Their ability to get the goods and services to you on time. Does he have limited resources in terms of a technical person to make him available to you to do work at your, because that one person alone is working, or he has lost both his technical people and therefore there's nobody there to help you. So you now have to go out and look for that service elsewhere. That's why he needs to be involved in your business continuity. What is his sustainability? What can we do prior to different seasons coming in place in order for us to ensure that our equipment is in a good working condition? Look at the scenarios of the different types of supply chain disruption to your business. Possible loss of clients, cancellation of contracts, inability to absorb product and services. You may be able to produce the product or the service, but the client's demand has dropped. So therefore his need of you has also dropped. So therefore your financial income has dropped. So you need to look at it that way. And you have to look at it from each and every single client that you have or service that you have. Don't look at it on a broad-based basis. You're going to miss something. You've got to do it individually. Okay, we're talking about ABC organization. What do they do for us? To what extent? What is the cost? How reliable have they been in the past? What are the problems have we seen with getting this product or service in the past? Let's give them a risk rating. How can we work with them to improve that? Do we want to work with them to improve that? Or do we want to go elsewhere? It's your business. You have to make these decisions. So at that point in time, you have come, you've sat down, you've looked at your operations, you've looked at your employees, you're now looking at your suppliers, and you're building your business continuity team in terms of the people you're going to be sitting down with to build this business continuity plan to ensure that your business will continue during and after a disaster. Third-party services, again, we spoke about transport and so forth, the ability to maintain the supply chain, equipment maintenance, service, refrigeration, vehicles, housekeeping, security. Housekeeping is most people don't look at housekeeping at all. They say, oh, don't worry, every night the place gets cleaned out. We have somebody who comes in and clean, we have a cleaning company and so forth. But let the place really get bad and see the impact on your employees. All right? Public utilities, electricity backup, water generation, and so forth. I am doing this now from home, not because I choose to. I'm the only person in my office right now. But I wanted to go to the office and do it, but unfortunately, we're having electrical fluctuations in that area of Port of Spain right now. So for this not to stop, the decision was, where did I have a reliable source? And home was the best place to do it. What are the resources required for the suppliers, partners, contractors need to conduct their operations? So what is the due diligence? The ability to maintain quantity and quality, and how long? What are requirements will be included in our contract and in our agreements? Because it's one thing to supply me with a quantity of product, but I'm also looking at quality. For those of you who have a quality assurance program, that should be in your contract. The same applications you put to your employees, you are putting to your suppliers. List actions to protect your business. And we're going to go through the people, process, and the profits partnerships at this time. Implementing protective measures to require significant changes to the workplace process and practices. What measures do we have to put in place? What protective and preventative measures are required to require significant changes to the workplace in the process or the practices that we do? Help with the transition and consider gradual resumption of activities. So we are looking at what's happening in the workplace and what's going to happen now in terms of the gradual resumption of activities. The number of products or groups or activities, logistics, process flow, all these different things before you return to work, and for how long and at what speed. People, the work environment. Have you identified the hazards in your work environment? Have you done your health and safety risk assessment as required under the OSH Act? What mitigation strategies have you put in place to correct these things? Have you been monitoring it to see if it's working? Has it been reviewed annually or semi-annually to ensure that it is working and maybe changes needed to be done? Whenever you have changes to your operation, you have to review your risk assessment and all of these strategies to meet those changes. Many times I see small and medium-sized businesses especially, they have grown in terms of not quantity of their operations, but the quality of their operations and what they do. The systems have changed, they become more mechanized, highly technical, sometimes even still very manual. But what they have not done is change their operating procedures. What they have not done is recognize where the vulnerabilities in the new system is and identify it, because it hasn't happened yet. And most of the time they're waiting for it to happen before they act on it. No, you need to do it before. You need to brainstorm it, work on it, and do it before. What are the special needs on specific threats, such as pandemics? And I think now we've gone past the part where we're going to say, well, that's never going to happen to us. Right? We're going to stop saying that. I hope so. Because one day there's going to come a hurricane that's going to hit us. One day there will be an earthquake that is a high magnitude for enough time to cause serious problems. One day there will be other threats to this island and to the operations within this island that we have to look at. And what changes do we need to make in order to prepare our people to deal with these threats? And looking at government regulations and standards that ask us to handle them. So, people. The process, building and machinery, retrofitting your facilities or equipment to meet the need of the hazard. In the Caribbean, we have equipment that is 20, 25, 30 years old, working alongside equipment that's 10, 5, 3 years old. One has all the whistles and bells and tells you everything that's going on with it. The other one you have to know by the sound of the equipment. Some have safety features, such as hazard beams that will stop the equipment once you break the beam. Some have special features that you must have one hand on a throttle switch in order for the equipment to work. Once you remove that hand, which is called the wrong word, but a dead man switch, what will happen is that the equipment will stop. And other equipment will just keep going, no matter what, until you stop it. So you need to look at your equipment. You need to look at your building. How is your building set up? Can you really do social distancing in your building? Do you have enough space? Does your operations allow for social distancing? And can you do it? Do you have to go maybe and segregate your operations so that one operation takes place from 6 a.m. in the morning to 10 a.m. and another operation will take place from 11 a.m. to 2 and another. So therefore now you end up with the same amount of employees, but on a shift basis in order to implement social distancing in your factory or in your place of business and keep your operations going. Enhance personal protective equipment. We are talking, everybody's talking about personal protective equipment now in terms of COVID-19, but I'm talking about it just in your operations of your business. Is it there? How can it allow does it in any way infringe on the employee's ability to do the process? Actually, some processes require it. So you've been doing it while you're at work because you're working with food. So therefore you have to wear a hairnet, you have to wear a face mask, you have to wear gloves. So you've been doing it at work, but now you're doing it at work and outside. Maintenance of equipment and machinery, workspace, time for that, time for sanitization, time for special maintenance programs. Raw materials, receiving and delivery, imports versus exports, changes in regulations. All right. If you happen to be a distributor and you have to drop your product up of your clients, how that has changed, where you used to take the product and bring it directly into the client's place of operations, even into a specific storeroom and put it there. Now, because of COVID-19, You have now come to a new understanding with the client. We will bring it to the warehouse, to your loading docks. Your people will move it inside. So we are working to our end destination is the loading docks. Your people is from loading docks to warehouse, warehouse to shelf. And you can't just do this. You have to sit with your client and have this discussion, right? And the same thing goes for you receiving imports from everybody else. Once the goods come, this is where you bring it now. We move it from here to there. How is it handled? Do I have the space to do that? What retraining is necessary with my people in order to do that? Profits, finance, disruption negatively impact on your clients and their ability to buy your product or service. We've seen it during this pandemic, certain items were being snatched off the shelves while others remain. Right. People had a limited amount of disposable income or income that they can use to do their buying with. And they were making a decision that, look, I need more of this, or I don't want to run out of, therefore this will be a scarce item and what we call panic buying, and people are buying it in bulk or a lot more than they normally buy and foregoing other products. So the other products are now slowing down in sales. So that's disrupting your profit. If you're doing exports, or if you're receiving, what percentage of your goods and services come from a non-domestic market? What do we import? Impact of disaster on those markets, high-risk areas, raw materials, sales, the final product. If you are supplying a hotel chain, industry up the islands, grocery stores with a particular product, and you're unable to get your product to them, they are going to be looking elsewhere for people who are able to get their product to them. So you are looking at, before things get the impact of the pandemic, you will be looking at how much stock do I have? Where do I have it? How long will it last? What is the LIFO, FIFO? In other words, how the stock is going to be moving quickly. What is the impact on me in terms of loss and liability where there's a failure for me to meet my contractual agreement? Am I liable to suit? I went into a store to buy something I require on a monthly basis. And I know a lot of people use the same thing. And the person told me, oh God, Robert, I'm sorry. I had a large stock, but somebody came in here and they wanted everything. They panic buy. My question to them is, well, you have more than one customer. Can't you ensure, maybe you're not able to get the quantities you want right now, but can you ensure that, for each customer, based on their needs, that you'll be able to supply them with a certain amount, so for it leaves some left over for other customers? His answer to me, I try, but some people, they walk in, no, I want all, give me all, I want it. So he has not met his contractual agreement with me in terms of my service. So now I have to go elsewhere and run this down. That can mean a serious liability to me in terms of my need for his product. And I guess by now you consider it's a medical product, right? Disruptions of negatively impacting on your main suppliers and the ability of your suppliers to inputs to your enterprise. So disruption negatively impacting on your main suppliers. How much? You would not know that unless they're part of a business continuity program. They will not know that unless they're part of a program. And their ability to supply you with information so that you can decide what is next on the table. Where do you have to go? And an understanding that this is what's going to happen because you are unable to meet. my demands or my needs. Profits, economic environment. Many of us don't have any control over that, but the economic activities directly impact on our business and the markets to operate, or you expect it to. There's been increased, if there's been increased criminal activity in your area, people are not working, they're not getting paid, they want a product or service, or they want something, and they decide to use alternative methods of getting at that. Criminal activity in terms of breaking into your business places and losing product and sales. Theft from within, theft from without. All of these as a result of depressed economic activities. There's been a sudden increase in price for inputs of goods and services. So your price of your product has gone up at a time when people are saying, well, I don't have the money, but guess what? Your supplier has increased his price. How long can you afford to keep to purchase that high cost supply and then pass it on to the customer? How do you deal with that as a business? So you have to look at your profit margins and see exactly in this type of industry, in this type of climate, what do we do? How do we fix that impact? Partnerships, basically utilities, water, health, sanitation, significant disruptions to the public utilities. We know about that. We live with it from time to time. But you have to realize that if there is a demand for anything at any one point in time, it puts a drain on the system, and therefore there will be an impact. And again, we go back to your tolerance to deal with that. Third parties, customers, competitors, financial providers. Have you sat with your financial backers? Have you gone to your bankers prior to something happening and talked about how are you going to continue your business if there's a negative impact on your business? In these times, sometimes competitors even get together and decide on how they're going to share materials in order that they remain competitive. There was something on CNN where in some part of the United States that two competitors in the same town, two factories who competed with each other, actually got together and started making the same product. But one factory did one type of work at another time, and another one was doing another one in order to keep as many people as employed as possible. That's a rarity, but really and truly, that's something you may have to look at. Right. Increased lending obligations, less choice of providers, negatively impact. What are your choices for financing for your operations to continue it if the economic impact hits you that hard and you don't have the money to continue, but you need to get financing? Remember, you close your business and you say, okay, I'll open it up when things are better. Doesn't mean you're coming back to the same economic climate or to be able to do the same type of business or even have the same customers, because you're gone. People move on. Political and regulatory environment. Negative or sudden changes in regulations, laws, and so forth. How does that impact on your enterprise? What is coming? We're looking at the government talking about rent restrictions, wage subsidies, these sorts of stuff. There's something that, yeah, in terms of dealing with that. So what is the government doing in terms of wage subsidies? Are we offering those people who are unemployed a certain amount of money? Are they able to come back to work when you're ready? If we reach the point of a state of emergency, major restrictions of freedom of movement and so forth, how does that place a threat on your business? How does that impact on your business? So government regulations and what the government decides to put in place and how does it impact on your business. Establish a contact list, right? Who can you have meetings with without having non-physical meetings? WhatsApp, Zooms, meetings, and so forth. What are the lists of the people you need to be in contact with on a daily, weekly, monthly basis in order to know where you're at with your business? You don't want to have that proverbial phone call at 6 o'clock in the evening saying, I'm unable to make my delivery in the morning because. Business continuity planning forms these relationships with your suppliers and your clients so that you are able to talk with them and say, this is what's happening with me. This is what is going to be happening with you. This is what I can bring to you. This is what I cannot do. This is the time period in which we're doing it. There has to be cooperation between all stakeholders in this. You also need to, when these things such as it's a health pandemic or when we're dealing with other types of disasters, the government agencies, ODPM, Health Department, Labor Board, all of these are people who we need to be in contact with, or at some point in time, we need to have discussions with in terms of what is required of me as a businessman in keeping my business going. And we all know that the government has put out several publications. In terms of the Ministry of Health has put out a publication on going business facility institutions reopening after the restrictions, and the new normal, which just came out from the Ministry of Health. And also, so OSHA has put out guidelines for reopening with the coronavirus. And those are publications I think you need to look at and to read. You may find a lot of the information is very similar, but you need to look at it to when you're making your decisions about revamping, reopening, or again, bringing your business back up to the full potential that it was before the virus hits. Maintaining a review and continuous update of your program. As I said before, you need to test your program respectively. What are the lessons learned? Make the changes, go back into it. Update your health and safety risk assessment. Strategies for business continuity. Look at them again. Are they meeting? Are the goals of your business continuity plan the same as your goals for your business? Businesses change from year to year. What are your goals now? Are we still on the same path together? Operations and procedures. Again, many times when we look at operations and procedures of companies, we find that what you have in your operations manual and the procedures that are going on the floor are different. And they have not been changed or updated. And we need to look at that. Health restrictions. What is the requirement for a worker coming back out to work now? What do you need to do to ensure that you do not have a second round, or a worker does not bring the virus within your organization? Or even if you see symptoms that are similar to what the virus has, people will panic. Hey, I'm not working with him because he only coughing and sneezing. This person may be suffering from allergies. And with the Sahara dust and other things in the air, their allergies are acting up. So it's not that you're isolating them for allergies. You're looking at what are the restrictions of being at work, understanding what are your health requirements for your employees and what you need to do about it. And last but not least, of course, your financial viability. Where's the income coming in? How much of income is coming in? How much is being reduced? Your income ratio. Where else can you get financing if necessary? And also to how does it work with your suppliers and clients? Because you have to speak with them in your BCP plan. Without them, this plan is not going to happen. Okay. This is the point where we take a break or take questions, I believe. So, Mr. Ram Logan.
Yes, okay. Thank you so much.
You take over at this point.
Thank you so much, Robert. I think in this first part, you did a good job of kind of going through the steps that needed to be considered in terms of your risk assessment and your continuity planning. I took note of the 6 steps, the 3 phases that you talked about in terms of the BCP, and you emphasize the importance of communication. Now, for those companies that are unionized, that may not be an option, but it is an important requirement. Personally, I like to stress the importance of joint management labor committees. It really helps with getting buy-in at all levels and, of course, participation. I do want to ask, though, Robert, if we can quickly, before we entertain any burning questions, if we can you hear me?
Yeah, maybe just come closer to your mic a little bit. I think your volume is not too loud.
I'm sorry, is that better? There we go. Can you hear me? Yeah, so what I was saying is if you can maybe quickly go back to the document that you were sharing at the very beginning, and maybe use one of the first protocol or the first couple of protocols to give an example of just kind of review again how you complete that document, especially with regards to the calculation of risk based on severity and probability on the document. Maybe you can just quickly, in 2 minutes, just kind of go back to that document, because that would be important for the participants.
Right, this is the document, right? Okay, what we're looking at here, this is a basic risk management document of risk. You're looking at the protocol. Now you can do it for anything you want. You can break it down to departments, a process, anything at all, to the macro as well as the micro. And we're trying to use this on a micro level right now. So what are we looking at? We are looking at the document. What are the protocols, right? Is it physically unsafe for a worker? Number 2, is it physically unsafe for a worker to come and go from your workplace using shared public transport? The answers there is B in the ILO risk assessment, yes or no. Now, if you say yes, you get points. If you say no, you don't get points. And they use those points to tell you where you're at with it. I am now taking it to another level, right? If the answer is yes, I want you to tell me what existing controls you have to make it safer for the worker to come from work, right? We provide transport. In that transport, we have social distancing. We require that they wear the mask at all times. The transport is done on a shift basis. So people working at a certain shift will be picked up. We have central areas of pickup and drop off. We don't go specifically to the house. So we deal with it on a general, in terms of general areas of working. So you put that in there. How safe do you feel that is? Well, let's do a risk assessment. 1 being low, 5 being high, severity versus probability. I would put a 1 or 2 in here saying that yes, it's the severity of it is low, but the probability of something happening to them is about a 4. It's high. Not as high as a 5, but high. Why? Because I'm not dropping them in front of their house. I'm dropping them at a central area. So they still have to go from that central area to their home. Now, me may not have any control over it, but the probability of them getting either the coronavirus or getting robbed or something happening to them is still there. So therefore, what will be the risk rating? 2 4s are 8. So you got that 8 in there. Now, you understand that part. Now, 8, at the bottom of the form, you will see this. Risk rating, severity, and probability risk, right? So 8 falls under medium, is between 7 and 14. So that really is a medium, and that chart is at the bottom there for you to look at. And it also gives you some PPEs that you can include in your program. So that tells you, okay, it's medium, it's an 8. How can I reduce this even further? Right? One of the ways, and again, is it practical for you to do it? Don't just say it and not know if you can do it. One of the ways is, let us do a house to work pickup. Is that practical for you? Yes or no? Is it financially feasible? Yes or no? So you may not have any other controls to put in there, but you may have more controls. And if you decide on, yes, we are going to do, in certain areas, we'll do a house to work pickup. Therefore, the severity of it will still remain a 2, but the probability of the person getting injured or having anything will be reduced by maybe to a 2 or 3, and that will give you a 4. So you have actually brought this risk down from an 8 to a 4, which is going from a medium risk to a low risk. So you have used a tool that can show you how you can further reduce the risk to this particular protocol. I don't know if that answers the question.
Yes, I think that clarifies usage of the tool. So thank you very
And
much.
the thing about it is that this is not written in stone now. Because I think within the next 6 months or the next 3 months, you'll go back and you look at it again and go through the same process. Let us see where we can reduce the risk. Now, one of the ways of totally eliminating the risk is not do it. And you say, well, there's no risk to you, but the risk to your employees still exists because now you're putting him on public transport.
Okay, great. Thank you very much. So I would quickly like to move on to any burning questions that participants may have arising out of what was just discussed. You can use the raise hand button, participants, at the bottom of your screen. I do recognize Reena Maharaj. She has raised her hand, so I will allow her to speak. And once a question is asked, she will, 1 second. Once a question is asked, I will disable her microphone. Reena, if you can identify the company that you're representing, please go ahead.
Hi, I actually pressed it earlier on in error, but my question, I'm representing Trinidad Tobago Stock Exchange. In terms of the BCP assessment form, I know you said the webinar will be shared. Will that also be shared? Or is that just a sample?
Oh. No, that will be shared.
Okay.
And we have done 4 of them. One for the different designations: people, process, partnership, and so forth, and profit. So you will get all 4 of them. And like I said, if the question really does not apply to you, just put not applicable, but think about it in terms of future use as well. So you may want to put it on a to-do list or something that is coming up later on that you'll have to look at it.
Okay, thank you for that question. We do have a question here in the chat. Of course, participants, please use the Q&A if you can to send your questions, but I'll raise this question, Robert. This question comes from Denise Bellamy. The issue of government assistance was raised. However, we are not sure how we can plan for government assistance in the BCP. Our company provided assistance for our employees in accessing the government assistance or grants when the measures were announced. However, we do not know how this can be part of the plan. Do you care to comment on that?
Yeah, the government assistance will not come until the powers that be decide what they're going to do. So planning for it is hard, but knowing that, listen, depending on how the pandemic runs. Now, I don't know if we have it here, but I know that in certain countries, through the emergency management services, businesses can apply for grants and for different sorts of stipends through government to help them with their business after going through the impact of an emergency. So that is there. what we need to explore is what is available to us, because sometimes there are things out there that are available we don't know about that we can use. If it is that you have made provisions for your employees, you also will have to look at some point in time when the government decides to bring out their own program, how does that impact on yours, and how can you meld the both so that the employee comes out the better for it.
Is it safe to say, therefore, that in doing your planning, including government grants really may not or should not be a consideration? You should be planning independent of those provisions, simply because grants and assistance is not something that we can predict. It's offered really based on decisions of the government.
If it is that it is not available and there are no ongoing or services like that is available through government, no, you can't plan for something that's not available. All right, so therefore you would not plan for it. But if there are services such as that are available, that are ongoing all through the year that you can call upon, then, you know, you can.
Okay, I will recognize Ricardo Henry. I believe he has a question. Ricardo, go ahead.
Good morning to everybody. My name is Ricardo Henry from the Trinidad and Tobago Civil Aviation Authority. And I just had one question with regard to the assessment form that was developed. Good form, thank you. Just one question, reference the choosing of your numbers for the impact and probability. I realize it can be very subjective. Is there a methodology for the choosing of the number that you're going to see, whether it's going to be low, medium, or high in terms of your impact and probability? How would you, to assist the others and everyone here, how would you recommend that part be done? Because just as you were giving an example, you said you could think, well, maybe I think it might be a 2 or maybe a 4. So, I mean, how do you go about in terms of your assessment and in that sense? Thank you.
I guess I was too loose in my how I did it. What really happens here is that when you look at severity, you would look at, okay, what is the impact? How severe is this impact going to be? You have to understand the operations to understand the impact. Someone using a hammer, what is this, the worst thing could happen to them if they hit themselves or hit their hand? Let's say they're pounding a nail. They hit their hand with a hammer. What is the worst thing? They will break their bones, right? Will that cause death? Not really. Will that cause some disability? Likelihood, yes. So I will rate it a 4. It will not cause death, which would I say is the most highest thing you can get, but it will cause a disability because it could shatter the hand in such a way that the bones are unrepairable. So therefore the person is at a disability. And that's how you do it. And when you look at the probability, how probable is this to happen? It depends on capability, how the person is using the equipment. Are they knowledgeable in that? Frequency of using it. And also there are tools that you can use. Instead of holding the nail with his hand, he could hold the nail with a pair of pliers. So therefore, if he struck anything, he will be striking the pliers or the wood instead of striking his hand. I mean, you know, you look at it in that way. So it tells you how highly probable it is for it to happen. You may have incidents happening on a regular basis, people squeezing their fingers and so forth. Very highly probable, but the impact is very low because the severity of it is a 1 or 2 where they get a cut, maybe a squeezed nail, nothing that will go into any type of major medical needs or disability to the person. I don't know if I was able to explain it to you.
Yeah, I think that's it's pretty clear. Also, maybe just to emphasize, there are 4 separate documents. So when you're looking at the impact and the severability of whatever the item is, you're looking at it based on either your people, processes, your profits, or your partnerships. So look at it within that
Right,
context when
exactly.
answering the questions.
That's why I did it on 4 different forms, because I think if I had put it as one big form, people would have gotten confused. Now, again, you want the people who are responsible, who have the responsibility for those areas, such as your financial people, to be doing the one with profits, because they are the ones who will know what are your costs on a daily basis, monthly, for running your company. What are the lowest costs you can run, or what is the highest cost on one end, and so forth and so on. Your operations people will be looking at the processes, right? Your marketing people and also your operations people will be looking at partnerships, and also your finance, because we are talking about your clients and so forth and so on. So when you get those people who have that specific responsibility or knowledge within the organization to do this assessment, they're doing it with that knowledge. And then when you bring it back to the table as a team, you're further amplifying it, and you're further taking it and taking it to the next step where you're saying, well, this is what we can do. There's another step we can put in here, or we can also do this. So you understand the whole concept behind it. Hello?
Yes, okay, thank you very much. So I don't see any other raised hands at this point. So what we will do is we will, 1 second. Yes, what we will do is we will take a short break, and this is just to allow participants to maybe sort of stretch their legs, grab some water or coffee. And we have about an hour again left in our session today, and we do have a lot to cover. By my clock, it's 12 o'clock on the dot. If we can return to your current positions by 12:05, we will proceed into the next session. So we'll break now for 5 minutes. Thank you.
Oh.
Okay, great. So 5 minutes by my clock, just about 6 minutes. I hope that everyone is still with us. I think we're on now to what is going to be a very interesting part of today's session, where we're going to be talking about return to work. I know some companies have already been allowed to return to work. Some have been working throughout the existing stay-at-home orders. Some are still at home. Either way, as Robert alluded to before, things are going to change, and we may need to change the way that we organize, the way that we work, the way that we deal with our people, the way that we deliver services, among other things. So this session now will deal with safe return to work guidelines and considerations for employers. Of course, we will take questions at the end of this presentation. So please send your questions through the Q&A, and we will be sure to get to them at the end. So I will hand over to Robert, and we will proceed with the second part of today's presentation.
Okay, thank you very much, Ronald. Just before I run on to the next part, I just like very much to talk about two things here. One, that the ILO assessment is a yes or no assessment, and it's not included in my presentation. So I'm going to send that to the EC as a separate document. I would like you to do that. It's a simple one. You ask the question, the answer is either yes or no, then you add it up, and the total amount of points you get is 61. If you don't have that, they tell you what your rating is. But what I am trying to do, and I want you to understand this, is that the risk assessment I send you, in addition to that, is when you're taking this and putting it into operations, and you're looking to say, okay, what do I have and what don't I have? Is what I have enough? Do I have to go further with it? And the risk assessment itself, the numbering system, gives you an opportunity to say, yes, this is here, it's low, but it could still be better or lower, or it's too high and I need to bring it down. I hope I explained myself there. Okay. So let's go back onto the program. Oh, it's there already. Right. So we are now going to speak about returning to work. You're going to be opening up your businesses. I think it's next week, is the beginning of phase 2. And you are going to be getting ready right now for bringing your businesses back online and getting them going. So how do we prepare for that? All right. Basically, in general things, we are looking at the layout. You want to look at the layout of your organization. You need to get yourself, I don't know if you have them, some as built drawings, some floor plans and so forth. Actually look, this is a lot of people don't look at disasters as opportunities. I was reading a book last night that talked about fires. And the author said, fire is a good thing, because fire, to forestry people, to so on, so on, so on, it gives growth to new life. And it's the same thing with the disaster. If we look at it only as the impact on what I have lost, as opposed to what I can build on, right? That change that you have wanted to make all these years that you're not able to make, now is the time to look at that. Is it feasible? Can I do this? And will this also, within my BCP plan, reduce the risk of the magnitude of whatever hazard I have identified within my plan? So this is a good time to look at that. So what you're looking at is the layout of the changes in the layout of the physical distancing, all right? Symptomatic cleaning and disinfecting of workspaces. I live in Santa Cruz. There's a grocery around the corner, and he closes every day between 12:30 and 1:30, and they say it's for the staff to go for lunch, but they also go do sanitizing and wiping down and so forth. So they've made a decision when they're going to do it. Supplies, protective equipment for people, so forth, people getting what they need to do during the course of the day. Remember what I said in the beginning. Let's bring that into this, getting prepared. You need to have a committee. You cannot do this by yourself. You cannot take on all of this responsibility on your own. Who is responsible for what? In terms of training, information on how to use, how to properly use a mask, how to properly take off gloves when you're finished with it, how to proper way of washing your hands, what to use, when to use it, that sort of thing. What do we have in the facilities? Are there any no-go areas in your facilities where people are not allowed? What are restrictive now? So all of these things you have to consider by looking at the layout of your operations, okay? Again, I always said, update your risk assessment. This is your requirement under OSHA. And it's not just to put a section called COVID-19 and do it. It has to go with each part of your operations. What is the impact on each part of your operations and the hierarchy within the operation? So keep that in mind. Maintain an open dialogue with your workers, trade unions, and so forth. You need to talk to them. One of the ways of getting people not to buy into your program is to do the program and then bring it to them and say, here, this is what I want you to do. Remember, these people are experts in what they do. No matter how menial the job, they are experts in that. And therefore, you want to get them to buy into it. Otherwise, they will not do it. I've said this time and time again, and I'll say it again. You can write the best health and safety policy, disaster preparedness plan, BCP plan in the world. If everybody is not on board with it, it will not work. It will die on a shelf. Okay? So get your committees together, give them their directives. What is your main focus? And let's all work together in doing that. Workers' important contribution to assessing the risks and identifying solutions, right? Are we looking at shift work? Are we looking at telework? Who's, you know, some people look and say, how come they get to stay home and I don't? You know, there was a client that called me and he had to do that because he only brought in, out of 12 people in one department, 4 at a time to keep social distancing. But he gave them various days of the week to come to work. And then all of a sudden, this one wanted to be off on a Friday and this because they want to do this. No, it's not about social planning here. This is about work. So I said to him, when you did the planning for that, did you sit them down with you? He said, no, I made the decision and that was it. I said, well, that's one of the problems you have there. So if you had done this and then start with them and say, look, this is my recommended schedule for you all, but this does not change. It has to, only time it changes and so on. So you may not have had as much problems that you're having now, right? Involve experts if necessary. Call in your consultants and so forth, your HR consultants, your HSE consultants, the different people, in order for them to give you guidance in this, all right? Talk to the ECA. They have a lot of experts within the organization with many, many years of experience and so forth. They are the experts in this. They can help you and guide you in this. That's why they want to put on these programs. Monitor frequently the requirements and recommendations issued by the relevant health and labor departments. Now, remember, I told you that there are several publications out, one from OSHA, one from the Ministry of Health on business facilities and institutions reopening after the lifting of restrictions. There are some by the ILO as well. Look at all of them. Look at what works for your industry. You may have to tailor it to your industry. You may not be able to implement it as is, okay? Allow for local laws and regulations. Again, as we said, what are the requirements under that? We are going into phase 2 on the 7th, I believe, and that will allow all businesses to open, certain things to be happening, but still the requirements for mask, gloves, and all of the other things are still in there. Information on training workers, COVID-19. There's still a lot of misinformation about COVID-19 going around on social media, and a lot of people are dismissing it, you know, as being a common cold and so forth. Folks, this is we have to educate our workers in that this is serious business here. All right, and this means life or death in some cases. So again, we have to look at it. We don't know when the government is going to lift the travel bans for those of you who have to travel for your job, like I do sometimes. I have clients up the islands who I'm not able to visit now, but I do talk to them regularly on Zoom and so forth. So, but there's nothing like being there to deal with something. So we have to look at when is that going to happen again? And what's the availability? Because let me tell you, a lot of people are going to be traveling all of a sudden. All right. Keeping track of your workers. Many new businesses have these high-tech cards. As soon as you walk past the front door, they register you in, they register you out. You can lock people out, so forth. Some of us still use punch cards. Some of us use a sign-in register. But know who's on your premises and when and why. It's no longer a free-for-all. Okay? People who normally just come to visit, no. Visitation is not allowed. If you're here on business, yes. All right, we have to look at our HR policies very strongly now and change them to suit the times until such times you can relax it a little bit. But it will give you the opportunity to really become very stringent on these things. All right, I am a very, very strong proponent of not having children in the workplace. I don't care if you put them in their own space, as long as they're unsupervised, that's room for something to happen. And it's on your premises. Be very sure when you start opening up your businesses, your policies on entering and leaving the workplace are extremely clear and precise. Make sure workers are allowed, who are aware of the company return to work plans and procedures. So they need to get this not the day they come to work, but before they come to work. So you need to do some sort of pamphlet, some sort of email, letting them know these are the requirements. All right. And that it will be enforced. And we are still going to do disciplinary action up to and including dismissal. Support for mental well-being of your workers. Some of your workers might be coming to work under duress. They have lost a loved one, not to the coronavirus, but because of just circumstances. They were ill and they have passed away. They have not had that grieving time. They didn't get to go to the funeral because of the coronavirus. A lot of different things, closure. So this person is coming to work with a lot of mental pressure on them. And you need to use your EPA program, your HR programs to deal with these workers, to talk to them, to help them through this process. Because, you know, these are people that you want to hold on to, you want to keep in your organization, been there for a long time, but you have to help them through this, all right? Preventative and keep reinforcing, you know, the risk situation that is involved with coming back out to work. Right, hygiene measures, washing your hands, that's a given. Okay, respiratory hygiene. I heard a gentleman in a plaza a couple of days ago. He went into one store, I saw him, he was in front of me, he washed his hands, he went in, he was looking for an item. He came back out and he went into another store and the guy said, you had to wash your hands. He said, but I just washed my hands up the road there. He said, partner, I don't know about up there, but you have to wash your hands before you come in here. And I have to see you do it, right? There is implementation, and then there's, you know, having to understand that these things to some people, while they will do it, it's a requirement, don't pressure them on it. You know, the person said, look, I just washed my hands right next door. I went in the store, I'm coming in here now, because I didn't want what they have. I want what you're selling. And I understand your need for it. But, you know, the emphasis on getting these things done, train those security officers or those people you put to monitor this, please, on how they talk to people. I can give you stories upon stories about this TSTT in West Mall. Oh God, don't talk about that. You know, I mean, it boggles my mind how this person made these decisions. So you need to make sure that they're trained, they have clear guidelines on how it works. Okay. Respiratory hygiene, again, wearing your mask. There are different types of masks. What are you allowing, what you're not allowing. I personally have problems breathing in the cloth ones, so I use a lot of the disposable surgical mask and so forth. You know, what are you dealing with, right? Are you making this available to your employees on the floor so that they can go to a dispenser and just get one and use it? Okay. Cleaning of the workplace. When will it be carried out? At what times? During the course of the day. Sanitization of general areas where people work. We'll talk about that later on. Your ventilation system. Right now is a good time to get them to come in and do a general cleaning, do the vents and so forth. You know, there are a lot of allergens and so forth that are in there besides COVID-19 that you're dealing with. And we spoke about personal protective equipment. On personal protective equipment, just a quick note, I won't stay long on it. There are some personal protective equipment we call in the field community equipment. Let's say a respirator. You may have two people using the same respirator on different shifts. Because of this COVID-19 now, that can't work for a while. So you're gonna have to either invest in another respirator or one person use one. But even though you're sanitizing it, how the other persons feel, how the employee feels about using it comes into being. And the Occupational Safety Act talks about perceived risk. It don't have to be real, it could be perceived. And we have to recognize this, right? Worker vulnerability to the disease, we are very much familiar with that. What are the risk factors of illnesses? Being informed, currently available about older adults, the older person working in your organization, the type of work they do and so forth. People who have medical conditions. Again, this is a good time. Look at your medical history form for your employees, revise it. You need to add some things to it. Like I said, this is a good time to talk to the experts. Send it back out there. Everybody needs to fill this out. This is a good time to update those records. All right. If the person is working in groups or have to work as part of a team and so forth, in that you have to talk to them about what else they can do to deal with the vulnerability during COVID-19. All right. Assess cases, recommendations for particular protective activities, including work incapacity. So again, advise workers that they belong to a group that can be more vulnerable to corona, and they should consult with their doctors. All right, worker vulnerability, preventative measures include telemarketing, reassigning workers, lowering the task of COVID-19. Doctor can also advise increased preventative measures at home. So if you're sending workers home to work and so forth, you can only give them recommendations to follow. Remember, you have no control over somebody's house. So you're giving them recommendations to follow in terms of working at home and how they can protect themselves within their homes dealing with COVID-19. All right. Before leaving home, instructing your workers with symptoms. Do you have a fever, dry cough, sore throat, so forth and so on? What do you need to do? Stay at home, contact a medical center, right? Have them look at you, have them say that this is not COVID-19, even if they want to do a testing. But you need to know once you have the symptoms. If anybody's watching the news right now in the United States, you're seeing that the dust mask has become a political thing. If you're not wearing If you're not wearing it, you're for this person. If you're wearing it, then you're for that person, and that sort of thing. You've also had situations where, you know, people are being bullied into wearing or not wearing. And you don't want to come into that situation here. We want to make sure that your employees understand the need for it and why they're doing it, and it is a requirement of the job now. Okay? Worker should be informed of his or her supervisors in any situation that comes up, and we go through the chain of command of letting the person know, look, I have this, that, the other, I'm going for this. And it is to be monitored. You don't just show up the next day and say, okay, I'm fine. Okay, you have to have some sort of policy in place that says, okay, did you go to the doctor? What did the doctor say? We need to get a note. All right. So once you have gone into self-isolation or you've decided to quarantine yourself for that period of time, I think under the OSH Act, where we talk about having a fit to work, that could come into play here. Transport and form of work. Short distances, encourage workers to walk to work, use foot or bicycle. Well, I could tell you bicycles in Trinidad and Tobago ain't gonna work from personal experience. But at the end of the day, all right, how do workers come to work? There was a large company in Trinidad many years ago that did a risk assessment on their workers, and they realized that almost 80 or 85% of their workers who lived in Port of Spain were coming from the deep south and had to leave home at sometimes on oddly hours at 3:30, 4 o'clock in the morning to beat the traffic to be in Port of Spain. So they had another 2.5 hours, 3 hours before they actually report to work in Port of Spain, and they were going to the gym, they did this, they did that. And what they were worried about is the fact that what this did was cut down on their ability in getting a good, nice rest, because they did the same thing at night. They waited till 7:30, 8 o'clock to go back to south. That means they didn't get there till 10. So their 7 hours or the rest period was low. And also to the fact that they're traveling all these distances. And they put measures in place to safeguard their employees. Encourage workers to avoid public transport. I don't know how lucrative that is, but especially at peak times, but make sure that when they do use public transport, that they wear their masks, either gloves, or they use sanitizing wipes and so forth for the areas that they're sitting and so forth. Folks, again, let me go back a little bit. I have been hearing about this long before COVID-19. We talk about this on airplanes when there was a survey done where they swabbed the headrests, the tray table where you eat or put stuff, and the side arms on the airplane, and the bacterial count was out of this world, up to including E. coli. Okay? So again, we are now becoming aware of what we need to do. All right? Remind workers of the importance of maintaining good hand and respiratory hygiene before and after traveling. All right? And if possible, if we are providing transport. Employers with providing transport, bus or van or so forth, make sure it's properly maintained, the one distance maintenance. Example, number of persons can sit in the transport, making sure that's properly sterilized from time to time, and that face and protection and so forth is being used. Consider increasing the frequency of transport or the provision to reduce congestion. Pay attention to proper ventilation. In some cases, while we have grown very much accustomed to having air conditioning, it may not be the practical thing to be at this point in time in the transport service. All right. Again, cleaning and taking care of that, and avoid overcrowding at access points. Right. Consider before entering the workplace, temperature checks. And we don't mean with the thermometers. We are looking at the digital thermometers with the laser. All right. And make sure the person using that knows how to use it, because if you point that laser beam in somebody's eye, you can cause damage. It is a form of laser. It will cause damage. Make sure the person doing that knows how to use it, and then not flittering it around the place like a toy. I've seen that happen before. All right. You look at the person, you inform them, I'm going to check your temperature. Do not take it for granted because I'm coming in, I'm going to be checking your temperature. You inform them, excuse me, I'm checking your temperature. I'm going to your forehead or wherever, point it, check it. That's it. The person knows. They know not to move, not to shift, not to cause an accident. You have to be careful. These instruments, people take them for granted, but they can cause damage, right? Make sure you have regular entries into your register and the entries and the exits. Even keep track of the number of people you have tested as opposed to the number of people there, because there are going to be people who are missed. Avoid congestions, and they say, no set of lineups, you're keeping the 6 feet and so forth. Stagger work times. Stagger work times so that you don't have this congestion. All right, and promotion of good hygiene habits. What about inside the workplace? Changing rooms. Have to have it sanitized regularly. All right, I love changing rooms to the fact that there are certain industries that I do not believe you should be traveling in the clothes that you did your work in, especially in the healthcare sector. All right, you've come out from an environment where bloodborne pathogens and other pathogens could be on your clothes, and you're traveling with it. All right, I'm a proponent, change your clothes before leaving. If for some reason it cannot be done when you get home, don't hug your children. Go straight to the bathroom, take it off, put it in the dirty, have a separate dirty clothes basket for your clothes from everybody else's. Depending on the industry you work in, it's very, very important. All right. Provide additional temporary changing rooms if necessary. Ensure clean changing rooms regularly, shifts, and it's always being monitored. Bathroom facilities. People, when you use a toilet, put the lid down before you flush it, whether you urinate or otherwise. It has, and it always will have, particulates which come up from it, and you can breathe it in or it could come onto you. Okay, please do that. Respect physical distances and so on. That there was something on social media the other day where there were about 12 urinals and every other one was covered up. Hey, I wasn't laughing, I was very happy. Okay, it works. How many people can use a bathroom at the same time and so forth? Provide liquid soap for hands rather than bar soap. All right, paper towels rather than a cloth towel. All right, and so forth. Regular cleaning of bathroom facilities and desanitization each day or during the course of the day. Canteen and rest areas, right? These areas need to be sanitized regularly. Again, it may be hard to keep social distancing here. Human beings, this is hard for us. We are social animals. All right. We look forward to sitting at lunch with our partner and having our lunch and talking and so forth from the day and so forth. And that has disappeared. But you need to understand the reason behind it. All right. Ensure the coordinations measures below. Keep avoiding workers leaving on the site during meal breaks as much as possible. Because when they go off the site and then they're coming back on whatever they went off the site, they're bringing back with them. And that's it. That's the philosophy behind this. Hi, I'm sorry, I lost the I lost it just now. Yeah, so again, when you're looking at this, people going out for lunches, people going to buy their lunches and so forth, they have to realize that when they come back to work, they have to go through the same situation of sanitization and personal hygiene and so forth. Tables before you sit at it or ensuring it's properly wiped down. Yes? Right. Thank you. I got it back up. Okay. So again, lunchroom, avoid congestion. Let me move this. Right. Sometimes using workers in shifts, having shifts for lunches, and that sort of thing. We have missed a couple of people. Ronald, do you want me to wait a minute for other people to come back on?
Yeah, maybe we can hold on a sec. Let's see
Yeah.
if we can get everybody back on. It seems as if that was a Zoom issue. They seem to have restarted our meeting. I don't know why, but just give us a minute.
I don't know what happened.
Okay, I think we can proceed. I think we've gotten most
Okay,
everyone
right.
back on.
So again, as I said, with the canteen areas, making sure that they are properly sanitized at all times, and try to stagger your lunch times and your break times so that you don't have as much people in there as they would normally have. All right. Right. Set up canteens to maintain physical distancing again. Chairs further apart, reduce the numbers of available. Reduce or eliminate serving food from common sources. Right. You want to have, you know, if you're serving food in your cafeteria and so forth, you know, you want to have them separately and so forth. You have microwaves, make sure that they're properly sanitized and so forth. Consider changing food service to prepackaged grab and go options if that's available to you. Sometimes it's not. And try to encourage less cash payments to avoid the handling of cash or one person alone doing that. But again, they will also have to take the same precautions. All right. Okay. Basically, let's go on to organization workstations, production lines, promote teleworking from home if possible. If you have to have workers at work, if you have a production line, look at the flow, see how many people you need to have. You may have to slow down your production process by 20%, 30%. I don't know, in order to accommodate less people on the line or social distancing. But that is something you need to work out with your production people. All right. What is the best maintained production process that I will have to keep up with my demand, but have proper social distancing and all the necessary things to return back to work? That means you may have, when you only used to have one shift, you may end up having two shifts now, in order that you have the same production, but less people in the production cycle, right? Rearrange workstations to maintain sufficient distancing, that sort of thing, right? Right. In case a team worker commit limited size of teams, fixed teams, minimum contact between the people, how many people do you really need to work this thing? How can you reduce these teams? All right. If anybody gets sick or quarantined, the whole team then needs to be quarantined and looked at. So you're looking at a situation where if one person becomes down, you may have somebody you may have to quarantine 4 or 5 people. Remember, I talked about that before. And we need to look at that very seriously, because that could put a whole section of your company out of business, or close it down for a while. All right. Apply for markings for safe distances. I see a lot of that going on. We know about it. So that where you have customer service areas, people who come in to do business, make sure that you have your safe distancing. I see sometimes the lines go out the doors. I see people have put up tents because of the weather, that sort of thing. So again, when we go back into business, if it can be done by appointment, let's do it by appointment. Make sure that everybody knows ahead of time what is the requirements for coming into your facility. Face mask, personal protection, whatever else is, right? Equipment. Many times workers have to share tools. So in sharing tools, there must be some sort of cleaning or regular sanitation of the tools between shifts, or even between workers. You know, you're a mechanic, you have one tool bench with all the tools you need, and you're picking it up, dropping it down, going back and forth. Some people don't pay attention to it, but it is a risky situation to be in, and you have to make sure there's constant sterilization. I very much want to promote the fact that where there's a customer area and where there's a work area. Many times we go to some auto mechanic places or some places that deal with your vehicle, and the owner of the vehicle comes in the work area to see the work the person is doing or to talk to them about it. That should not happen, especially now. It is dangerous to start with. It's even more dangerous now. So if you don't have clear signs in your work area saying no customers beyond this point, put them up. Put up the sign, put the line across the ground, clearly make it clear that the work area is not for customers to be there. If they need to talk to each other, set up an area for them to talk. Right? Again, keeping contact logs of those people coming in and out of your various departments and so forth. This is mainly in case we have to do any type of tracing, or to alert somebody that, look, the day you were here, somebody here has been come down with symptoms of the virus. We just want to alert you. You don't want to leave that hanging, right? That is tracing, and we need to make sure that we are able to do it at whatever point in time, right? Contact logs, right? Okay. Internal circulation. You want to limit that. People walking around the place, people going from department to department and so forth. You want to limit it, right? Some of your offices may be set up that you have to use a key, an electronic key to go from one area to the next. So you can easily disable a key to say that you cannot go in this area. That's easy enough. But where there's no key and everything is open, you have to put up signage. You have to let them know the rules of moving around the office. If maybe you need to set up a system of moving paper where 1 or 2 people will take the files or the paper from one office and have to move it into the other office, rather than the people in the office doing it themselves. So you limit the number of people who are moving around the office. Some offices, they call them messengers. They had them many years ago, where they used to go around with a cart and they just put everything on your desk, and you label it and it goes to the person and so forth. So you could actually implement a system like that, where you limit people leaving their workstations and having to move around, okay? In your use of elevators, limit the number of people in the elevators, not by what the elevator says they can have, but what is the social distancing. It may be an inconvenience where you have only 4 people or even 3 people in an elevator, but you need to make sure that social distances is continued. Even on escalators, that people are 3 or 4 stairs away from each other going up an escalator or coming down. All right? Enable, as far as reasonably possible, separate circulations of circuit spaces, tools, floor markings, tapes, and so forth. So we spoke about that. Circulation to introduce traffic corridors. Well, Having traffic corridors is a good thing within your office. It may not be practical depending on the size of your office and how many floors that your facilities have, but you need to look at it. All right. Also too, for example, in car parks, right? Lanes. I'm not saying every other car, but if somebody's in a car next to you and they're coming out, let them come out before you come out. So you try to limit the distance between the two of you. All right. Meetings and travels, cancellation of non-essential meetings and training and travel. What meetings can be done by Skype? Let's do it if we don't have to travel for a meeting. Salespeople, this is a big if right now. When you go to visit your clients now, you have to wear your PPEs. You have to do it. You have to follow the guidelines of the client that you're going in to see. So if your company says, well, oh, you only need to have a face mask, and then he says, no, you have to have the face mask, but you also have to have gloves, and then you have to have what that, because you're going on their premises. There are some people who have what we call merchandisers. They go into stores to restock shelves, to arrange merchandising and so forth. Again, you're required to wear the type of PPE that's required for the job that you're doing and for the business that you're in. So when you're going into your client's business and he requires this, you do what he is requiring of you. You can't say, well, my office only say I have to do this. No, you are in his premises, you follow his rules, okay? All right, meeting, I think we discussed a lot of that. Operations, washing your hands before exiting the workplace, spread out exit times, avoid congestion. Same thing, you know, we've spoken about this. A lot of these things are very repetitive. Partnerships, suppliers and delivery produce. Remember I spoke about that. If you have somebody delivering goods to you, you are running a store or whatever it is, you may make a suggestion or you will have a rule that deliveries are left on the docks or in a certain place. My people will move it inside rather than having a lot of people coming inside, because that person will have to wash their hands and do everything else as well. All right. You have to look at your operations to make a decision on that. All right. Many times I have seen where people make deliveries and they actually go straight into the businesses and put the deliveries on the shelf or put them in a storeroom. That may have to stop for a while until we can control these things, right? So there are clear demarcations, no one beyond this point. Right, we talk about number of workers to handle deliveries, consider that. Loading and offloading can be done. Deliveries in staged manner to avoid too many things. A lot of businesses, groceries especially, it's from the old days. Remember, groceries used to close on a Thursday because that's when they did their restocking. That's when they got all their deliveries. So you had all of these people coming in at the same time. You're gonna have to look at staggering it down. All right. Your client's operations, right? For companies who are in complexes or who are in multi-use buildings and so forth, what additional measures need to be taken when you go to visit your clients or your clients come to visit you? All right. If your office is in a multi-use facility, it's both a mall and an office building, you have a higher risk. So you have to be even more aware of your surroundings and what you do. I'll say something, all right, I won't go into that now. All right, frequently checks to apply for official requirements, recommendations for limitation and of operations of your activities. Put up signs. Please, you need to put signs up. This needs to be communicated. They must be clear, they must be simple, all right? PPE requires this, that, the other. Make sure it's there, it's available. Because if for some reason somebody gets hurt, if for some reason somebody makes a noise about it or say, well, you never had up a sign, you have the signs up. It was clearly there for you to see. All right. Protect your staff and customers, limit congestion, determining maximum number of people that can be in an area, inside your premises and so forth. And I think we are very much aware of all of this right now. All right. Floor markings, circulation of premises, and so forth. All right. Okay, they also talk about this plexiglass in terms of if you're dealing with somebody over a counter. And I see a lot of that up now, and a lot of people have innovative ways of some are using plastics and so forth, but what they can afford, but they are putting in some sort of protection. All right, consider taking orders online so that when people come and again, curbside pickup or delivery services and so forth. So we are doing that. These are a lot of things that we have implemented already. All right. What about your worker? Supports for workers. I mean, they're working under stressful conditions. I see from time to time, I see people giving employees a hard time for doing their job because they're trying to follow the rules as best as possible, but also be fast and get things done. And what is happening with them is that, you know, the client is not understanding at all. They want to get in and out as fast as possible. That puts the person under a lot of stress. All right. So when you have situations where you have people dealing with very, I won't say abusive, but clients who can be a little bit belligerent, you need to take them out of that line from time to time so that they can compose themselves, get themselves together before they go back and deal with it. Dealing with that on a day-to-day basis, hour after hour, day in and day out, can be extremely stressful on our employee. It is good that you have managers, supervisors walking the floor, that they are dealing with the clients and saying, excuse me, so and so is the case, this is why we're doing it this way. You know, being able to take that burden away from the employee so that the employee is able to carry out their job in a proper manner. All right. Also, too, when you're having the beginning of shifts and so forth, if it is possible, again, I want to recommend having meetings, just like how you would have a toolbox meeting on a construction site. Have a meeting with your staff. Reinforce these things. Reinforce some of the problems that you have seen. Remember, yesterday we had a problem with so-and-so, the person did this and that. This is what our policy. You see, events happen, incidents happen. We deal with it. We don't write it down and we don't pass it on, so that the next shift has the same problem and they're dealing with it in a different way. So the client will come back, or somebody who has had that problem on 2 different occasions say, well, one person told me this and another person told me that. What is the truth? We need to take these incidents, even if you're putting them in a copybook. I don't care how you write them down. Write it down. Share it with the next supervisor, manager, shift. Share it with your employees. We had a situation this morning where a man came to do so and so, and this is what happened. This is how we dealt with it. This is our policy towards it. If you encounter this and you're unable to deal with it, call me, call this person. These are the people who are there to train. You need to give the employee that support, that they know that they have somebody who is there to back them up when they're in a stressful situation. All right. Teleworkers working full-time at home, isolated and so forth. Again, people working at home, people feel that this Zoom thing is a great idea, you know, but it's wearing thin very fast. And there are people who are having so many Zoom meetings that they are having problems in terms of, you know, their timing and stress and so forth. Even eye problems, because you're watching at a screen constantly. So instead of using a computer infrequently during the day, you are now spending 3 hours at a computer when you are not accustomed to doing that. Are you in a comfortable position? Is it in a comfortable atmosphere? Can you really, you know, get the best out of this because of where you're located? I'm at home, as I said earlier, because if I go to it's fluctuating current. So we probably have that same situation even more. To avoid it, I'm doing it at home, but I would feel more comfortable in my office doing it. All right. Supporting teleworkers, giving them advice on their own mental health during a week period. We need to implement, if you do have it, or go to your employee assistance programs, find out things that you can do to find out from your employees how they're going. what's happening with them, what's going on at home, how are they making out financially. I work with a lot of different groups of people, professionals as well as non-professionals, skilled as well as non-skilled employees. And I've learned one thing over the 25 years of in this business. They all suffer from the same stress. It's just brought in a different way. And some people do not have the wherewithal to deal with it. I wonder sometimes how some people can get up in the morning and get out of bed and go to work, but they do it. All right. So we need to find some way of working with our employees, helping them to de-stress, helping them to tell you what's going on with them. It may be personal, it may be work related. All right. Remember, we spend more time with our working companions than we do with our own family. If you look at your wake time, you spend more time at work than you do with your own family. All right, and they become their family, they become your friends, and so forth. So communication, tools for communication is very, very important. So workers who have been temporarily laid off, all right, finding out how they're doing, how are they making out, giving them suggestions on what agencies that they are available to help them through this period of time, whether it would be food, financially, or even religiously, all right? Some people know that they're out there, but they don't want to do it themselves. They feel too proud to do it. So what you need to do is send them the information. Listen, contact this person at so and so. I've already spoken to them. They're willing to. They don't use the service. The fact that you made that effort is a great relief to those people. Worrying about if they can get their job back after the layoff, or where else can I go to find a job? What else can I do in the meantime? Support work, one of the things you're looking at is job form significant. Consider suggesting alternative activities, volunteering, training, and so forth. They may have some skills that you can use other than what they were hired for. If the person is very knowledgeable in their job, maybe using them as a training person with a little bit of training, they could be able to come in and help you with that, and thereby keep them partially employed or keep them going. Right? It's very important that the community people feel safe. Remember, under the Occupational Safety Act, safe premises. So again, I talk about mostly perceived safety. A lot of people come to work and they may not perceive it as to be in a safe environment. You have to let them know how safe it is. You have to talk to them about it. You have to let them know what's there, what is there to protect them, and what is there to protect the other workers, and what is there to protect your clients and your organization. All of these things need to be discussed with your workers. If a worker develops COVID-19 symptoms, the Ministry of Health of Trinidad and Tobago and the other has guidelines for that, which is basically that they will report to the nearest clinic, and the clinic in turn to the district office. They in turn may either come out and do the testing or have them transported to an area where they will be tested and to see if whether or not they do have the COVID virus at all. This has become a bit of a social stigma. What we have found is that people are not saying this, and I have to bring this in, it's not written in here. People are not coming forward to say, I have symptoms, because they're afraid of this stigmatism and go with, oh, I had COVID-19 and nobody wants to come next to you. It's kind of like what happened back in the 80s and in the 70s with AIDS, and people didn't want to go and get tested. They didn't want to be seen outside of the testing facilities that were set up by government. Oh, he going there to get this, he probably have it, or that kind of, you know, we're deeply um, conscious social people. And we need to be aware of how we react to people and what they're doing. And one of the ways of hiding this is by people underreporting, not reporting things because they're afraid of the stigmatism attached to it. So we need to work with the public health people. We need to work with our people in our employer assistance program to help people feel free to identify the fact that today I am having this, these are the symptoms I've been seeing for a while. What do you think? What should be the next step? Where should I go? And let us get the help of the professionals to deal with it. Sanitizing or cleaning areas after work, areas have been affected by workers. I have known companies who have had workers who have had the symptoms, and they have called in organizations to come in and do sanitization and cleaning in those areas. They've closed it off. They have protocols to follow, and they'll follow those protocols. So you just have to develop the protocols necessary to do that. All right. Follow instructions of health authorities, correlate with the immunological investigation, and we will continue with that. Well, that's it. In terms of that, you will get this. I know I skipped through some slides because they were very repetitive. But it basically talks about no more than about 6 or 7 different things that you need to put in place to get your organization ready. 1, sanitize your place before you open it up. Make sure you put your protocols in place for entering and leaving the facility. Have a recorder of people in and out of your facility. Have somebody responsible for monitoring the implementation of this so that you know it's being done properly. All right. Also, 2, safe distancings with your workers. Where safe distancings are not always that practical, you want to follow other guidelines that will help protect the worker, such as more aggressive PPEs and other sorts of personal protective equipment. And remember this, please, ladies and gentlemen. PPE is what it is. Personal protective equipment. It only protects the person wearing it. It doesn't protect anybody else. It is for your personal protection. It is the last in the range of protection that you will implement in a hazardous environment. Okay, we'll go through that. That's another health and safety lesson. I'm not going to start there. But what I'm trying to say is that you want to maintain it. And it is to be maintained. You can't use that same mask for a week. You can't. I have seen people cleaning a work environment. They have on gloves. They're taking the trash out of the trash cans and putting it in a bigger one. They're doing that. And then that same set of gloves, they're handling the doorknobs that I have to hold or you have to hold to get out. You have to train these people. You can't just hand it to them and say, you in charge of cleaning here, go ahead. No, discuss it. Come up with a training program. It's available now out there, whether online or through the Ministry of Health or through different organizations. Look for it and use it. Modify it to suit your needs. I'd like to thank you very much for this opportunity, for coming to talk with you and share the little bit of knowledge that I have and the information that has been given to me. I hope we have the opportunity to do this again in the future. I turn it over right now to Ronald.
Okay, thank you very much, Mr. Teelucksingh. Very, very, very interesting presentation. A lot of good information shared there. With the consent of our participants, we have a few questions, not many. I think we can get through them in a few minutes, relatively quickly. And then I will wrap up and share the information I alluded to our participants in a previous email in terms of the special benefit that they will get as being part of this session. So let me just go through quickly so many questions we have. I'll just go back. This one refers to the risk assessment. Of course, some
Ronald,
people may have...
Your voice is breaking up.
Can you hear me now?
Yeah.
Okay, I hope that's better. Just a couple of quick questions and we'll wrap up. Some people may have already had risk assessments in place. Of course, a lot of those safety-oriented type of businesses. So the question is, does the risk assessment for COVID-19, does it have to be separated from the normal risk assessment that would have been in place pre-COVID, given that there may be different issues specific to COVID?
Say that again. The risk assessment that's pre-COVID.
Yeah, so some organizations may have had.
Hello?
Let me try this
Ronald,
again.
yeah.
Can you hear me now?
Yes.
Okay,
wonderful. So the question is, some organizations may have had risk assessments in place pre-COVID-19. A lot of those safety-oriented businesses. So the question is whether the current risk assessment.
Your audio is gone again.
Am I there now? Hello, are you hearing me?
I just heard pre-COVID-19. What you're asking is the risk assessment? Okay, it might be my connection.
Does the current risk assessment
is the risk
need to be
assessment pre-COVID-19 still?
Yes.
Yes, it has to be updated. Risk assessments are required to be updated on an annual basis for the organization. That's your operational risk assessment. So what you would do is you will look at each area and you will say, okay, if you have the part of risk assessment that deals with an office area, you will do a section within that office area to deal with COVID-19 and what you have put in place for COVID-19 and how best it could be responded. When you have to deal with production in a particular area, you'll do the same thing, and so forth and so on. So each area of your risk assessment will have a subsection which deals with COVID-19. You can't just put a COVID-19 section in and that's it. Again, it depends on the size of your business as well, or what you're doing.
Okay, great. The other question quickly, is it okay to use the Ministry of Health guidelines and tailor it to suit the needs of the organization?
I think I recommend that highly.
Yeah.
You have to understand,
okay.
I am dealing with the international organization, the ILO, and these guidelines are generally set out for industries, companies, and businesses. So they are very, very, how can I put it? They're very, very open for interpretation and things. But what takes precedence is what the Ministry of Health says in Trinidad and Tobago.
If I'm not mistaken,
I would use the Ministry of Health.
Yes, if I'm not mistaken, a lot of the guidance that the Ministry of Health would have developed has actually been informed by what international bodies are advising. So, and I have looked at what the ministry released yesterday and today. A lot of what you've discussed is also contained in those guidelines.
Right. But the question was if you should use the ministry. Go right ahead.
Yeah. What are the protocols for security personnel interfacing with employees, visitors, or vendors at the point of entry, besides training, that is?
Well, the protocols will be that they have to wear their personal protective equipment. You have to limit physical contact, right? If it is that they have to do any type of searches in terms of your handbag and so forth, they must wear gloves. And after every person or bag, if they have had contact with them, they have to take off that glove. In other words, if I come and he says, Mr. Teelucksingh, I have to look in your briefcase, and I open my briefcase and he looks through it because that's a requirement for that building or there, fine. Take off the glove, throw it away, put on another pair before you see somebody else behind me. And you have to be very specific in terms of that. All right. You have to sit down and write your protocols to deal with all the different requirements for entering your building. You may have a requirement because your building is the ministry of whatever or the nature of this, that everybody has to go through a metal detector. All right. And taking everything out of my pocket and putting it into a bowl may seem fine in the beginning, but that bowl is holding so many other different things from other people, including whatever they had in their pocket, which would be a scrap of paper, food, whatever. So there has to be some sanitization of these things as we reuse them and not continue with it. So you have to sit down, you have to observe each and every step in your entry process and where security is involved, and you write the protocols to suit that.
Okay, great. Thank you very much. There was one question about monitoring and temperature. The question is, what else can the employer use to assess employees or visitors at the point for symptoms at the point of entry? Any other recommendation?
There's no other recommendation. Right now, the only monitoring that they're asking you to do is temperature. And I mean, you can't use a air thermometer or mouth thermometer because you don't want to have physical contact. So the only monitoring equipment right now that is currently available to my knowledge is the laser thermometer. And like I said before, it is a laser. It is just like a pointer stick. You should not be pointing it in anybody's eye and so forth, or pointing it across the road or at a building or anything like that. It's to be used what it's to be used for, and that's it. And you have to inform through signage and set up a protocol. Make sure the person is standing 6 feet away from you. Let them know that you're pointing this at their forehead or where the prescribed area that is required, and that you do it, and let them close their eyes just in case. There has to be safety in this to protect the worker as well as the client.
Yeah, and when you talk about symptoms, really the symptoms are temperature and of course those viral-related symptoms that can be really assessed via observation. Those are really the only.
Yeah, really and truly, they can't. If your person is at work and they're constantly sneezing, even though they have on a mask, I think it would be up to the employer to ask the person what's going on with you. You know, we want to be sure that you're okay. And if the person says, well, I'm suffering from allergies, and part of the allergies is whatever in the air, and I did not take my allergy medicine, well then, you know, you need to know that you need to be taking it regularly.
Okay, there is one more question that sort of gets into the realm of reduction of working hours and variation of employment contracts. So what I'll do is I'll hold on this question. We will share it with everyone when we send all the other documents out, as well as the response to that question, as it does deal with some industrial relations related issues that we won't be able to deal with in this particular session. So in terms of questions, that's it. Thank you very much, Mr. Teelucksingh, for a very insightful presentation. I know we've all learned a lot of, we've gained a lot of new information today, and certainly I hope we'll be able to go back to our respective organizations and implement what we have learned, or at least share it. As indicated before, we do intend to share all the material from today. Now, for those of you who would have registered for this session, what we are offering is a free follow-up session with you. So having shared the tools, the risk assessment questionnaires, will give you some time to go back to your organizations and have a look, start implementing, start to complete the implementation or assessment process, sorry, On June 8th at 10 a.m., we will have a 1-hour follow-up question and answer segment. We won't be doing any presentations. What we will be doing is coming with Mr. Teelucksingh to answer any questions that may have arisen based on your attempt to implement or apply the risk assessment tools in your respective organization. So June 8th at 10 a.m. for 1 hour, 10 to 11 a.m., mark it on your calendars. We will send a follow-up email. We will have a free session with all of the participants that are here today. And of course, we will share the material from today's session. So again, thank you to everyone. Thank you very much to the ILO for making this possible, to Vanessa and her team, Mr. Teelucksingh, and we will certainly see you on the 8th of June. So to all the participants, do have a safe and productive day, and we will see you in just over a week's time. Thank you very much.
Thank you very much, everyone.